Hi, in this video I'll talk about flopping behavior in children with autism. Flopping behavior can look different from child to child. This can be either going down on the floor, sitting in one place and not moving, or standing and not moving from a place. I will define the behavior, talk about its main characteristics, and last, I provide some general strategies that can assist you in effectively addressing and managing the behavior. So, what is flopping behavior? Flopping behavior, also known as going down to the floor or standing flopping, sitting flopping, is a type of behavior commonly observed in children with autism spectrum disorder. It refers to the action of suddenly dropping or collapsing to the ground, often without an apparent cause or in response to specific triggers or situations. The way flopping behavior manifests can vary from child to child, but some common characteristics include sudden and uncontrolled dropping. The child may collapse onto the floor without any prior warning or indicators. Non-responsive to prompts. During flopping episode, the child may not respond to verbal cues or attempts to redirect their behavior. For example, if you ask the child to stand up at that time, the child will not follow the adult's instruction and will continue to stay on the floor. Duration of behavior. The flopping behavior may last for a few seconds or persist for an extended period, depending on the individual child. Here's an example to illustrate how flopping behavior may look like. Let's say a child with ASD is in a busy shopping mall. The child may become overwhelmed by the sensory inputs such as loud noises, bright lights, or crowded spaces. As a result, they may suddenly drop to the floor. They may remain on the floor for a significant amount of time and not respond to the adult's direction, stand up. Now that you have an understanding of what flopping behavior is and what it may look like, let's talk about some strategies to manage this behavior. First, identify triggers. Pay attention to the specific situations, environments, or events that tend to precede or trigger the flopping behavior. For example, the child flops every time that the adult transitions the child to a new location. Every time the adult communicates, we will walk to the cafeteria or circle time, the child is going down on the floor and does not respond to the direction stand up. Second, provide a break. Create a designated area or space where the child can retreat to when they feel overwhelmed. This space should be quiet, comfortable, and stocked with calming sensory items or tools that the child finds soothing, such as soft blankets, weighted vests, or fidget toys. Third, use visual schedules. Visual schedules can help children with ASD understand and anticipate daily activities or transition. By using visual cues or timers, you can provide the child with a clear structure and advance notice of upcoming changes, reducing anxiety and likelihood of flopping behavior. For example, you will create a visual schedule that will tell the child what their day will look like. We will have breakfast, dress, go out for a walk, read a book, have a snack, go to the playground, have lunch, and so on. Fourth, Teach functional communication. Introduce and teach the child alternative ways to manage the flapping behavior. For example, you can teach the child to request a break when they need instead of using flapping behavior. Or you can teach the child to communicate verbally through pictures or AC device what items, activities, or locations they want instead of using flapping behavior. Fifth, implement social stories or social scripts. Utilize social stories or social scripts to explain and teach appropriate behavior in different situations. These visual tools can help the child understand what is expected of them and how to respond effectively, reducing the occurrence of flapping behavior. For example, you can use the social story and social scripts by saying, sometimes when we feel frustrated, overwhelmed, tired, or upset, we may want to flop. But there are other things we can do that can help us feel better. How about we find a quiet space where you can take a break and relax for a few minutes? We can sit together and take deep breaths to help calm our bodies. Taking deep breaths can help our bodies feel calmer. If you're still feeling frustrated, we can try using a stress ball or squishy toy. Squeezing it gently can help release some of the tension. Sixth and last, positive reinforcement. Implement a system of positive reinforcement to encourage or reward desired behaviors. Offer praise tokens or small rewards when the child demonstrates appropriate coping strategies or uses alternative behavior instead of laughing. For example, if you ask the child to join you for grocery shopping and the child communicates verbally through picture exchange or using the AC device that they need a break, you will reinforce this behavior by delivering praise and giving the child a break. Remember, every child with ASD is unique, and what works for one child may not work for another. It's crucial to observe and understand the child's individual needs and preferences when developing strategies to manage flapping behavior. I hope this video helped you understand what flapping behavior is, its main characteristics, and how to manage it. If you have any questions, make sure you type them in the comments below, and I'll do my best to get back to you. Thank you for watching. I'll see you in the next video.